Thanks, Chair. Again, I'd just like to start by, I suppose, thanking all the members of the HSE and all this.
Witnesses in room 2 are having difficulty hearing us, not relating to anybody specifically, but if we could all speak loudly and clearly, I'm being told by the ushers.
Okay, look, I just...
Sorry?
From the diaphragm.
I have a number of questions. I'd just like to run through them. I've only got 5 minutes, so initially I'd just like to ask, in relation to the National Treatment Purchase Fund, will the HSE be encouraging or recommending that patients who are travelling to the north for appointments or operations should continue to do so, or what advice are the HSE explicitly giving to those patients?
Deputy, as I understand the question, in terms of the NTPF appointments, we are continuing to work through scheduled appointments. We have put in place a number of stepping up our services over the last while, which includes NTPF funded appointments. Obviously, we're monitoring this as we progress through the current uptake in the virus, but we have started the approach of stepping up all our services, which includes the NTPF funded services, if that answers your question.
Yeah, that's fine. And secondly, just given the unpredictable yet devastating impacts of the COVID pandemic, is the HSE considering a backup plan for the winter months in the event of a second wave, so as to allow services to resume as close to normal as possible? And I suppose just linked to that question then, specifically to cancer patients, if there are future outbreaks of COVID-19 that might be worsened in the height of the winter months, is there any plan specifically to continue services as normal?
Yeah, just if I could take the first step, we have been working through a plan which is to see us through to winter, and also to see us through 2021. Just to make the point, we are looking at this plan very differently now, because it's not just about a winter plan and what we would normally have to do with winter. It's about how we cope and how our services cope, how we protect the public, how we protect our patients, and how we protect our staff with COVID virus, and at what level is the virus at different stages. So we're doing two things. We have significant funding already in place, which is supporting a number of initiatives that we put in place at the early stages of COVID. We're also finalising a set of plans with our board of the HSE and through government for a set of funding to see us through the winter and through 2021, which will involve a range of significant different approaches about aiming to keep people out of hospitals. The use of the likes of the community assessment hubs that we used during COVID in a very different way to treat respiratory illnesses, to try filter out the number of people who will need to come to a hospital setting, the number of outpatients that we can have in place outside of a hospital and in our community services, and a range of investments which are the traditional investments in home care packages and a community service and community intervention teams, the COVID response teams. So a range of initiatives that strengthen our community services, reduce the impacts on our acute services, but also significantly increase our capacity in the acute service too. And one further aspect, Deputy, sorry to be so long in response, one further aspect of that response will be our engagement, utilisation of the private hospitals as we did throughout the first phase, but in a very different way. And I'm happy to go through how that may look in the future, but that would be another support that we would have throughout winter and next year.
Okay, thank you. And just my final question just relates to meat processing plants and direct provision. The latest update provided by the HSE has been that this process is commencing. Can you just confirm that this is underway, and if so, have you any further details or breakdown of it?
Yes, Deputy, again, I can confirm it has commenced. We obviously completed significant mass testing in the meat plants over the past few weeks, and indeed in the first phase when we had some outbreaks in meat plants. Specifically in relation to the serial testing, that commenced again just last Friday, our serial testing in meat plants, and we completed a number of 3 meat plants over the last day or so, which has a total of 2,254 workers, 3 meat plants, 823 swabs completed, and that was in the 3 counties. Our primary focus on the serial testing is, and in terms of meat plants, is specifically related to plants that have 50+ employees. That can be a total of over 50,000 employees that we will be working through over the coming phases as part of that serial testing. Secondly, in relation to serial testing of direct provisions, we're working through that process right now with the Department of Justice and its agencies, just in terms of the scheduling of that and the data that we will need in advance and the planning and the scheduling of all of that. But in total, in our serial testing in the rec provision are over 8,000 people to be tested, about 7,500 residents and the remaining being employees. So if you take the serial testing of 50,000 in meat plants and 8,000 in direct provision, and also about 30,000 staff and healthcare workers in our nursing homes, which has been going on for the past few weeks and recommenced again, a current phase of it just completed. So 3 serial testing across those.